The following is a paid presentation for Trending Health.
Hello and welcome to Trending Health. I'm your host, Kevin Sylvester. Today on the show, we're going to learn about dental implants of different types, who they're for, and why they might be just for you. And joining me today here on the show, I'm happy to have with us Dr. Jeffrey Oswell from Rathdrum Dental. Doctor, thanks for being here.
Yeah, thanks for having me. Glad to be here.
I think we should point out Rathdrum Dental, there's one in Ireland, but that's not you.
No, that's a little far away. If someone tries to get to us there, it's a long trip.
Although Idaho is a beautiful place to visit, just like Ireland. But for the folks in Idaho, they should know you've got strong roots in Idaho. A lot of time there with your grandparents.
Yes. So my grandparents actually goes back to even to their childhood. They grew up in the Tri-City area, which is very close to where we're at. And then my grandparents retired out there on the same land that my grandmother lived on out in Bayview on Lake Pend Oreille.
All right, we're going to talk about implants and who they're for and why they're a great solution. But I just want to first point out your full practice dentistry all the way from little kiddos up to adults.
Correct. Yes, we're happy to see anybody of any age, and that can be kids who are just looking at your maintenance, your preventative kind of things, questions parents have about what they should be doing for their kids if they're 3 or 4 versus when they're 7 or 8, and at what point is it proper for them to look at orthodontics, and really just trying to transition them into their adulthood with good habits, good strong teeth that'll carry them through life.
Yeah, a nice foundation, and sometimes even with that foundation, things might go awry in life for adults, and that's where they need some restorative dentistry, whether it be dentures, implants. Who's a typical patient you see that needs an implant per se?
It's somebody who has run into maybe some hard times in life, whether that be through not being able to care for things properly, sometimes just health. Health really, overall body health can really take a toll on the mouth, and causes increased decay, increased issues with periodontal disease, and any one of these things can lead to a total loss of a tooth or of many teeth, then requiring something more extensive to really restore.
And it really affects all aspects of life, doesn't it? They're not smiling in family photos, I imagine. They can't really, nutrition is a huge thing here, and they can't eat properly. It's going to affect their health, isn't it?
Yes. I love the analogy of a car. If you're putting in bad gas and you're not doing maintenance and that sort of thing, then you don't expect great things out of your car. And so the body works the same way. When you're able to get proper nutrition, when you're able to eat the things that you really need to, then you actually get a body that feels healthier, it feels better. And so functionality is, of course, one of the things top of the list when it comes to restoring teeth with dental implants. When you're talking about along the lines of social aspects, we get people who come in, they're not smiling for pictures because they won't smile for you. They almost don't want to open their mouth because they're a little bit embarrassed of what you're going to see. And I always assure them, look, we've seen everything under the sun. This is not an area where we embarrass people. We don't shame people for where they're at. We're just happy to help you and help you get better and improve that quality of life in all aspects.
We're going to show some options here later in the program and how it's done in the process. But who are implants for? Who's the typical patient or person watching out there that should consider come seeing you for an implant?
If you're missing a tooth or teeth, you can be a candidate for implants. There's many reasons why almost everybody can get a dental implant. It doesn't matter if you've been even told at another dental office that you can't do it. We offer many solutions, many sizes of implants even to allow for that. A great way to think about this is go walk down the street and you're going to see many different people. Nobody looks alike. Even identical twins, they're a little bit different, right? So we have to have different implants for different scenarios, for different people. We can't just cookie cutter every single scenario for every person. And so we understand that, and we have options to help anybody in any scenario.
What about folks with dentures? Because I know a lot of people have problems with dentures. They don't stay in. I mean, Maybe I've seen, grandma or grandpa, the dentures falls out at Thanksgiving dinner, right? Unfortunately, but what about folks at Dentures? Can you help them?
Of course. In fact, that is one of the things that is probably most changing for somebody, because they've been dealing with a loose denture, an ill-fitting denture for some time. It may be something that was comfortable at first, but over time, our mouth changes, the bone in our mouth changes, and the denture doesn't fit like it should or like it once did. And so you start having issues, whether you're socially, talking, eating, all of those things are affected by how the fit of that denture is. So we offer solutions to be able to stabilize that denture, to be able to keep it in place better, to then eat the foods that you want. Things that were off the table, we might say, are now back on the table for dinner. And socially, you don't have to worry about something moving. And you also don't have to use a lot of adhesive. So the implants actually can attach to a denture and really stabilize it and keep it in place, so that then you have confidence in what you're eating and how you're speaking and going out to dinner and all those things.
Sounds to me like there are many more options today than there were maybe even 10 years ago for patients who fit these categories, are missing teeth, they need dentures, they've got decay, they haven't gone to the dentist. Sounds like there's so many more options that they're probably not aware of.
Correct. And the world we live in, things are always seem to be advancing almost faster than you can keep up with at times. But that's what we like to focus in on. That's our big goal, is to stay up to date on what's the newest, latest, greatest techniques out there. Also the tools. You're only as good as the tools you have. And so the implant styles and the implant matters on your ability to then restore somebody back to what their original teeth were. So the options are, yes, we can stabilize a denture, but we can also transition someone to a full set of teeth. That is what we might call a long bridge that goes around the whole span of a whole arch. And at that point, we can get that locked in place so that that person doesn't even have something that's removable at all. And at that point, their chewing efficiency, their ability to talk, to be able to function, really goes way, way up.
Yeah, their confidence probably goes up too.
Oh, for sure.
All right, I know you're wondering, okay, what do those look like? We're going to take a look at the different types of implants and solutions Dr. Oswell talked about when we come back here on Trending Health.
My name's Paul, and I came to you guys because I needed some teeth work done. Made a bunch of friends here, and this place, the whole staff has a good bedside manner. Eating since my procedures has been a joy. There's nothing I can't eat. There's nothing that bothers me at all. Give me a candied apple, I'll eat that baby, and it'll be gone in a heartbeat. Your staff is always professional, welcoming, just makes me feel good to sit in that chair. That's how tight it was with you guys and your staff. It's just amazing to watch, and comforting too. It just really made me at ease.
Glad you're with us here on Trending Health. I'm Kevin Sylvester, and once again joined by Dr. Jeffrey Oswell from Rathdrum Dental. We're talking about dental implants, solutions really for those who are missing teeth, those who have had bad luck with dentures or need dentures. And now we're going to dive into what these are, what these look like. And I know you have some models here to help us out with it, Doctor.
Yeah, so let's start out with where most people start out in life. You don't go typically from all your teeth to no teeth. There's a transition there. And so if somebody loses one tooth, let's say a front tooth, we have an option here, a model that shows what could be. So you lose a front tooth. A dental implant is something that's placed into the bone, and then we have this crown that is cemented on top of that. And it restores the smile, restores what I like to kind of joke about as the money makers up front, But it's not just that. It can restore more than one tooth. Let's say that we're in a situation where we're missing multiple teeth. You can place implants in a row that would allow somebody to restore in a bridge-like scenario, where then you restore a whole side of functionality. That's one of the biggest things, is when you start missing those back teeth and you start chewing just on your front teeth, they don't work so well that way. And it's all physics and angles and things, but long story short, they don't withstand that type of function for very long. They start breaking down easier, and you lose ability to really chew through things that you would want to chew through. Maybe a good steak, for instance, or even some vegetables, or things that you have to work through a little more. So restoring back teeth in this manner really helps the nutrition and your body overall.
I think it's important to point out for our audience, they're looking at the model and they're seeing "Oh, that one's white." Well, by the way, if your mouth looks like this, go see Dr. Oswell immediately.
Yeah.
But these are to highlight what the implants are. This is for model purposes only.
Yeah.
But also, you're gonna match them to their natural teeth.
Of course, yes. We even have our lab come in and take custom shades as needed. So getting the shade right is, of course, of utmost importance, because we don't want to have that one tooth in front that everyone goes, "Hey, what is that?" We want everything to blend in.
Now, if someone's missing one tooth, as your first example, does that usually stem from, maybe they had a fall or something, or is it decay with one? What's the typical person who comes in that's missing a tooth where you do a single implant? What's their typical story?
All of those stories, really, any one of those things. I would say a very common one is somebody at some point, yes, probably had an accident, maybe even some deep decay. They've had a root canal on that front tooth, and over time it tends to break down. It doesn't quite stay as firm as your natural teeth do. And so we see splitting, we see breaking, and we end up, unfortunately, in that scenario where we're missing a front tooth and losing that front tooth. And when that tooth comes out, with our 3D software, with our ability to be able to plan cases in advance, we can put an implant in place digitally, know exactly the spacing, the angles, and we place that implant the same day that the tooth comes out. That way they are never without a front tooth.
Wow, I think that's reassuring for folks who need this to know that, well, number one, the technology is amazing now, where you can have the precision, but also this is the same day.
Yep.
That part's incredible. What is the determining factor? You mentioned two words there that I think a lot of people are like, "Oh, root canal," right? Even if no one's had one, they hear root canal and they're terrible. Can this be done instead of a root canal?
It could. There are times where your natural tooth, we call it non-restorable, where there's been too much damage or a specific type of damage that we just can't recover. The body doesn't allow us to restore such tooth. And so, yes, there are times when you haven't had a root canal and we have to choose to do something like this. It is a real thing that happens.
All right. So the implants, and there are different types of solutions with the implants. Is that correct?
Yeah. I would love to show another example. So another example, if we've gone to a point in life where we've lost many teeth, and sometimes we term that as like a terminal dentition, you might say, where there's just too much gone, too many teeth gone, too much damage done, that we really can't just go tooth by tooth by tooth. It becomes rather tedious and not really economical for the patient.
Sure.
Really what it comes down to. And so we all know somebody who has a denture. It could have been a grandparent or something like that. And they have issues. They don't stay in place. They don't eat the foods that they want. Most of the time when they're at home, they're not even wearing them. That's the honest truth. And I have patients that come to see me and tell me they have dentures, and they go, "Oh, but I left it in the car. Did you want to see that?" That tells you how much they actually like them, right? They won't even come in to show you them. So the solution to a denture that isn't fitting well, to be able to get something that's really stable for somebody, is using implants. So this model here demonstrates how, you can see it's a little hard to take off, how implants can be used to hold a denture in place. Now, on the inside of the denture, we have what's called housings or O-rings, and those snap onto and secure the denture so that it stays in place. So it's not easily dislodged when talking, when eating, and your ability to chew, actually, the studies show, go way up. In fact, they're at times 3 to 4 times higher than what you get with just a standard denture.
What is the maintenance on that for the patient? Meaning, is that something that they don't take out and clean? Do they brush their teeth as if they were normal teeth?
So yes and no. It's a little bit different, but for the most part, yes, it is very similar to what you do with your natural teeth. As we know with a denture, it does need to come out of the mouth. You do have to clean it, scrub it. Soap and water is usually pretty good. There are denture cleaners as well. And then around the implants themselves, we ask the patient to take the denture out a couple times a day and actually clean and scrub around those implants. We teach all of this when they come in.
Sure.
We don't send somebody out the door and say, "Good luck." we teach them how to take care of this. They're making an investment in themselves, which I can say is a great investment. There's a funny thing where we'll go out and buy a car, and it depreciates in value. And we're throwing money at it for maintenance and all these things. And then we sell it in 3 or 4 years because we're tired of it. And with your mouth, I don't know if you can really put a true price on what it gives back to you. The solutions it answers, whether that's being able to go out and socialize with friends and family, smile in pictures, eat the foods you want. It improves the quality of life everywhere.
Yeah, it's self-esteem, I'm sure, their confidence. They don't have to worry about if they put their teeth in, if they left them in, or to bring them into the office to visit you. I noticed on that model, so it just kind of snaps in there, right? So there's implants in there that the denture snaps in. Is that as easy as it is for the maintenance to snap it out and do the cleaning, as you mentioned?
It is, yeah. We have different ways of being able to make it snap in easier or harder. Some people, like a car, they drive their car a little hard. And so they have to have something that holds a little better. But everybody figures out, we show them how to. It's a simple thing of just getting fingers under it and just popping it up and loose.
What's been the response from patients that have gone to this solution, that have used dentures, tried the glue, as you mentioned, they don't put them in their teeth in at home? What's been their response after you've implanted this?
Very positive. Most of the time they say, hey, I've been able to eat things that I haven't eaten in a long time. And to me, that's a win, because that is life-changing. Going out to where you want to eat, eating the foods that maybe you haven't eaten in years even. That is definitely a response that I get. And they seem to just kind of have a little more confidence with everything they're doing, whether that's going out or that's the foods they're eating. It's awesome. It's really rewarding for me to see how their lives are changing.
Is this solution, does it work for both upper and lower teeth?
It does, yeah. We have a lower model here, but it works just the same for upper teeth. Here's another option or an example of what it could look like. So that one is purely a denture-based material.
Okay.
This one here it's the material that we use more when we're putting crowns on natural teeth, you might say. That's the best way to relate to it. It's a hardier, longer lasting material. It can be made of zirconia, it could be made of porcelains. There's different options for it. This is an upper arch. One of the big issues with an upper arch is that the palate gets covered when you have a full upper denture. Now, I don't know about you, but I have trouble even saying my words without my palate being covered at times.
Yeah.
And then you imagine you put a big piece of acrylic up there, it becomes really difficult to do so.
Is it like the retainer that I used to have to wear after my braces came off to keep them in place?
You can say that, yeah. And you start
okay.
slurring your words, and your
Yes.
mom's going, hey, what's wrong with you? So an upper denture, we can get rid of the entire palate up there. What does that do? That creates much more freedom to be able to speak. You get much more ability to taste your food. People think that your food is only tasted on your tongue. There's actually taste buds located in other parts of the mouth, which the roof of the mouth is included in that. Some people have a really strong gag reflex. They put that denture in for the first time and they start gagging. They don't have any idea how they're ever going to get used to this or how they're ever going to go out and see somebody again, because now they don't have teeth, and when they do, they're gagging. So they're stuck between a rock and a hard place there. So when we get rid of the palate, we have an option here. This is a great model to show a type of arch of teeth that is very sleek, very streamlined, very small. And this is what technology allows us to do, is get something we're getting as close to your natural teeth size as we can with this. And this is something that can be permanently anchored into the mouth. We can retrieve it as needed, but it's not something that they need to pop in and out of the mouth on a daily basis and clean. You clean it like your normal teeth. Brush, we usually use like a water pick, those sort of things.
Sure.
And when people come back with this one, they are ecstatic at the changes that it's making for them and just being able to daily life.
That sounds like, if I can use a comparison to folks who go to contact lenses and the disposable ones where they can put in for a month and then take them out. So when you have this solution, you just wear this all the time, right?
Yeah.
And as you mentioned, there's probably some maintenance they come back and see you in 6 months for a normal cleaning.
Correct.
And then that's when you can maybe detach it and take care of make sure there's no issues.
Correct. Yeah. That's a great point. So when they come back, this is retrievable in office. We can take it out as needed. We can clean underneath it. We can clean around the implants as needed. It allows us versatility more than anything else, but then gives the person back something that is much stronger, longer lasting, and much more sturdy even than the implant retained denture. The implant stabilized denture, you're going to get much improved from a standard denture, but this one again is much improved even from the denture basis.
All right, with all three of these solutions, or four, I should say, that we've looked at, with the single tooth implant, the several teeth together implant, the denture, that newer style denture implant, what has been the success rate that you've seen with patients where these are lasting? Because I think that's one question folks might have. Well, if I get a dental implant, how long is it going to last?
Sure, that's a valid question, right? We want to know when we're getting anything, how long something's going to last. There's really not an expiration date on implants. There's nothing saying that they're going to go 10 years and then suddenly, well, that's the end of its lifespan. It really is a thing of how well somebody takes care of those. And so at-home maintenance is absolutely critical. And then, of course, coming into the office and taking care of them. But the implants are made of the same things that we do joint replacement with, whether that's a knee, a shoulder, a hip. It's titanium. It's commercial grade titanium. That doesn't have an expiration date. Titanium is strong, it lasts. And so it really is how the person takes care of things.
Sounds like it's a permanent solution as long as they do maybe what they should have done before.
You could say
before needing that.
We don't guilt them on that.
No, that's an important thing. You're not going to judge someone who comes in who's missing a couple teeth or needs a solution. I think some people might be apprehensive. I don't want to go in because what they're going to think of me.
Yeah.
That's not the case, is it?
No, not at all. Not at all. I have seen many patients in this scenario. And to me, I see somebody who's kind of hurting in life, somebody who really wants to have a solution that they can get out of somewhere where they just don't really know how to get out of that. And that's why people come to us. That's why we see people for consults. That's why we really address, hey, what is it about your mouth that you do and don't like? And let's fix it. Let's improve the quality of your life.
What helps you determine what solution is right for the patient who comes in, whether it be the single one, the double one? I mean, obviously the number of missing teeth, but maybe for dentures, what helps you determine which solution you think is best for that patient? Because that's also important to know. This isn't just, oh, hey, you're in for this. This is what you're getting. You're going to figure out exactly what that person needs.
Sure. It's not a cookie cutter scenario. We can't just simply look at somebody as every time they come in, we can do the exact same thing. People are different and their ability to care for things is different. And maybe the quantity of bone they have available in their mouth for being able to place implants. So that's what we have to determine. When someone comes in, we can let them know what solutions they can do, what solutions they can't do. And typically though, we can offer somebody something that is far above what they're working with at that point. And there really isn't a reason in most cases why we wouldn't be able to use dental implants.
I imagine a lot of your patients who have come for implants, that have come for a better denture solution that you've fitted them for and sent them out the door, they probably come back and say, everybody keeps saying there's something different about you, but they can't figure it out because these look like natural teeth, don't they?
Yes. We've had many people come back to us and tell us, people are noticing my teeth. People are saying, hey, you've got a nice smile. They don't know why. They just notice that. And so it's really fun to hear those stories when someone goes out and they start smiling at people and they're getting compliments maybe that they've never gotten before.
It's fun for you and the staff, isn't it?
Oh, of course, 100%.
Yeah, helps bring that passion out. Well, you heard what Dr. Oswell had to say about it. Let's hear from some satisfied patients.
Had some teeth issues and looked around, picked Dr. Oswell, came to Rathdrum, and got myself some implants, uppers and lowers, and it was a game changer for me. Having 3 teeth that were missing, implants were my route because I wanted them secure and I wanted them to be there. I just wanted to have teeth that stayed in. I do eat the things I want to eat, apples, corn, steak, no more gumming. It's actually chewing and getting to enjoy the meals that I do eat.
Great to hear from some patients and also great explanations and all the solutions. So now people are saying, I need to get in to see Dr. Oswell. The number's on the screen. It's simple as making a phone call, isn't it?
It is. So call that number and one of our staff members will happily answer the phone. They're all trained and versed on being able to answer that call, understand over the phone what it is you're looking for. We offer free consults in our office, and a person can come in and find out what solutions are available to them. The process of that is we're going to ask a little bit about your health, understand you as a person. We want to know what your needs and what your wants are. We do a 3D x-ray. That helps us to really see what's available to you. What can we do for you to make life better? And that part is very helpful on our end to know how we can help you. And then comes the part that we got to transition to how we can make it affordable for somebody. And so we have a person dedicated in our office just for that reason. And if you come in with insurance, we'll look through that insurance. We'll figure out how to maximize that insurance for you. And then also we'll figure out how to make your patient portion very affordable. It can be broken down over payments, over time. And that's something that is very, very helpful because it can be a barrier to getting into a solution for your mouth.
You said two things there that I think resonate with me: life better and affordable. And those two things sometimes don't go together, but they do here with this solution, because this is going to improve someone's life who needs this work, isn't it?
Correct. And it's hard to put a value on that. And when we talk about affordable, it is a thing that we want you to be able to have this solution. We're on your side with this. We're on your team, you might say. And getting somebody to what they're truly looking for, what's going to make that difference in their life, is our ultimate goal.
You do welcome them to bring a guest, if you will, a spouse, a friend, to come also be an extra set of eyes and ears, right?
Correct, yeah. So an extra set of eyes and ears is always helpful. Someone you trust, it might be a family member, a spouse, a good friend, someone you trust that will help you make the right decision so that you don't feel alone or on an island with this sort of thing. Having a friend is such a great thing when you're talking about making a big life decision. I mean, anytime I make a life decision, I'm always going to talk to somebody about it. It's a big decision, and so we want somebody there with them.
And if someone out there is apprehensive, there's no need to be. You're not going to judge them. You're going to give them as many options. You're going to welcome them in to help improve their life.
Yeah, I'm not a pressure person. I'm just simply going to present what solutions we have available for you and let you make a good, educated decision going forward of how you would like to treat your own mouth and what kinds of things you want to improve on.
Dr. Oswell, thanks for being here today. A lot of great information and great solutions.
Thank you for having me.
All right, the number on your screen, that's what you call for that free consultation. You've probably been putting this off. This is the time. The time is now. Make that phone call for that free consultation with Dr. Oswell. Improve your dental health, improve your life. Thanks for watching Trending Health. I'm your host, Kevin Sylvester. We'll see you next time.
The preceding was a paid presentation for Trending Health.